Okay, so I'm going to be performing trach suctioning on my patient. I have identified my physician's orders and my patient. I performed hand hygiene, donned clean gloves, and I put on my splash mask and my gown. I'm going to put my patient in high Fowler's position or semi-Fowler's and turn on my suction to the appropriate level. Right now, I'm hyper-oxygenating my patient. I'm just going to let him sit there for a few minutes at 100% flow, high oxygen. The reason why we're doing a rebreather mask is because he does have a tracheostomy, and a nasal cannula and a non-rebreather is not appropriate at this time. And then we do want to watch for oxygen toxicity, so signs of restlessness, irritability, difficulty breathing, increased work of breathing, things like that. So after that, I'm going to take off my gloves, perform hand hygiene, and I'm going to set up my sterile field. I'm going to open my package, and then be sure to only touch the cardboard part. And since this has already been opened, I'm going to put the label to my palm and lip it in a trash can and then pour some in the cup. So now I'm going to put on my sterile gloves. I'm going to start by putting on my dominant hand. These aren't mine. Ideally, these would be my gloves. But since they're not, we're gonna go with it. Okay, so we have oxygenated my patient. We have set up our sterile field. I'm gonna grab my sterile catheter and take my non-dominant hand. I'm going to remove the oxygen from the patient. Just place it over like that, that's good. Get my suction and plug it in, just like that. And then we're going to just get some sterile saline, sterile water. We're gonna go in 4 to 5 inches or until the patient coughs without applying suction. And we're gonna rotate it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Ideally that wouldn't happen either. Okay, we're gonna act like that never happened, and I'm still in sterile field. So I'm going to listen, auscultate, and I would let my patient rest for 1 minute in between passes. So I can just go 1, 2, listen, listen, listen. And then in between passes, I can ask my patient to cough and deep breathe. So let's say that the patient does need a second pass. I'm going to suck up some more. And then go in 4 to 5 inches or until the patient coughs. I go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Well, now that sterile field's over with, I can put the oxygen back on my patient. I clean up everything and then auscultate his breath sounds again. All right, and then I would take all of this off and then perform hand hygiene, and then I would document the procedure, how the patient responded. I would document the characteristics of respirations and the lung sounds before and after suction was provided. Again, there was only 2 passes provided, no longer than 10 seconds, and sterile field was maintained.